This is TTT Live. I'm DK Rosta. It is the day the Ministry of Health is rolling out its COVID-19 vaccination program, and this is 1 week after some 36,000 AstraZeneca vaccines from the COVAX facility arrived in the country. We now take you to the St. Joseph Health Centre, where Health Minister Terence Dayal Singh was being screened and is getting ready to receive his vaccine. So we take you there now.
That he would take the COVID-19 vaccine when this batch of Oxford AstraZeneca vaccines arrived. He is here this afternoon to deliver on that promise. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health. Thank you for joining us at this very significant phase of our nation's response to the COVID-19 pandemic. Before taking the vaccine, the Minister will address the media, followed by a short question and answer session. The Minister will then take the first of 2 doses of the Oxford AstraZeneca vaccine. He will then be observed for 30 minutes, which is a standard procedure after taking this vaccine. The individual, at this time, Minister, I invite the Honourable Terence Dayal Singh, Minister of Health, to the podium to brief the media, followed by a short question and answer session. Honourable Minister.
Thank you. Thank you very much, Al. Good afternoon to ladies and gentlemen of the media. Good afternoon to citizens of Trinidad and Tobago, wherever you are. Today, Tuesday, 6th of April, is the most significant day in the history of Trinidad and Tobago as far as public health is concerned. Because today in Trinidad and Tobago, we started off, as promised, our national rollout of our vaccination program against COVID-19. And from all reports so far, barring a couple hiccups, which you will expect, things have gone relatively smoothly. I am pleasantly surprised at how things have gone, and for that I want to thank everyone at the Ministry of Health, the entire team, and the teams at all the RHAs who operationalized the plan. Barring 1 or 2 hiccups, things have gone remarkably well. At this point in time, I would like to give you the figures as they stand as of 2 p.m. in an effort to give you some idea of if we are going to hit our target of 1,000 doses per day. Now, when we had set that target, it was my feeling we would have taken some time to get up to there. The current figures are these. North Central RHA, 234. Northwest RHA, 63. Southwest RHA, 274. ERHA, Eastern RHA, 72, and TRHA, Tobago RHA, 84. That gives you a total of 727. That is at 2 p.m. Some sites are going up to as late as 6 p.m. today. So it is quite likely we will not only meet the target of 1,000, but also beat it on the first day, which is something I am so happy about. I am really, really pleased about that. What it means is that the level of vaccine acceptance amongst the general public is high, and that is good. That is very, very good. It means we have an intelligent population, we have a population that believes in the science, and we have a population that trusts the vaccine. I would like to address the issue now of bringing on more sites in the near future. Under Northwest RHA, we'll be bringing on 3 more sites within the next 7 to 10 days. The reason why we could not bring on more sites under Northwest is that many of the health centers within the city, for example, Oxford Street, George Street, and Woodbrook, were just not sufficiently spaced in terms of floor area to accommodate a vaccination program. But we are looking at 3 other sites because we recognize that persons in and around Port of Spain need more access to the vaccines. And that's probably why Northwest, you're only seeing 63. So we will be correcting that within the next 7 to 10 days, and those figures will go up significantly. I will be coming to the media again in about 2 weeks to share with the media the plans for our mass vaccination sites. We intend to double and triple the amount of vaccination sites within the next 2 to 3 weeks to a month as we escalate and increase our vaccination rates. The target of 1,000 a day is our initial target because I'm seeing, unfortunately, even though we say it at the press conferences, it doesn't mean that we are stuck at 1,000 vaccines per day forever. And unfortunately, I'm seeing some commentary that did not pay attention to what we have been saying at the press conferences. 1,000 a day is what we anticipate for phase 1. And we chose that number because of the limitation of vaccines. But as more and more vaccines become available and we ramp up sites, those numbers will escalate very, very quickly. So it's not going to take years, as some people are suggesting, to achieve herd immunity. I now want to address the issue of the Honorable Prime Minister being tested positive for COVID. The OPM would have sent out a release this morning, and I am informed by the OPM that they will send out updates regularly to keep you, the media, and the national public informed as to his status, just as was done recently when he had his procedure at West Shore. I have no further details to share at this point in time, but in all transparency, the OPM, the Office of the Prime Minister, will be sending out updates as they see fit. So this afternoon, I am going to receive my vaccine. I have walked with my vaccination card. So we're asking persons to dig it out. I dug out mine last night. This is my old vaccination card. But for persons who don't have one, a new one will be provided, but it will make it easier for us if you walk with your vaccination card. So my vaccine will be registered in this card, the brand of vaccine I am getting, the batch number, the nurse who administered it. Correct? Which is normal, standard operating procedure for any vaccine, also the expiry date of the vaccine. So those are my few comments. I am now open to questions before I proceed to be injected by the nurse. So I am open for questions. Thank you. Yeah. Yeah. Sure. So as we do for all persons who are positive, for all persons, this is standard operating procedure, and that has begun, yes, in Tobago.
And where are we with that? Can you share any details?
I don't have those details. The contact tracers will have that.
Where's the Prime Minister at the moment? Is he in a health facility or what?
I don't know his exact location, but I do know he is in isolation, as the release did say.
When we posted the news this morning when it came from OPM, we had a considerable amount of people saying that they believed he said contracted the virus, so he wouldn't have to take the vaccine.
That is absolute old talk. I mean, the Prime Minister is a very upright, straightforward person, and he has, as the press release said, contracted COVID-19. And when you contract COVID-19, and if you have any flu-like symptoms, you cannot take any vaccine. Is that correct, nurse? Even if you have a stuffy nose, a fever, you can't take any vaccine.
All right, we read the numbers to us, and you're very proud of those numbers. So you don't believe that the news this morning had any impact on any public trust in the vaccination process?
Negative or positive?
Negative.
No, because these figures are good. So there's no negative fallout.
Good afternoon, everyone. So just to bounce off of what I was asked, we have some fresh reports coming in.
Hold on a sec, please.
All right, so as we know that phase 1 rollout of the national COVID-19 vaccination program continued in Trinidad and Tobago today, which is with the vaccination of healthcare workers and persons aged over 60 years and older with non-communicable diseases, NCDs. People who are part of the NCD clinics in the 21 designated areas, and the Minister just gave the good news that it will be expanded. Those vaccine facilities are not required to pre-register or make an appointment to get the vaccine. Those aged 60 and over will be offered the vaccine when they come for their NCD clinic appointment. Other members of the public who are aged 60 and over with NCDs can call one of the 21 designated COVID-19 vaccine facilities to make an appointment on non-NCD clinic days. A listing of the 21 designated COVID-19 vaccination facilities and the contact numbers is available on the Ministerial Health's website, www.health.gov.tt. A note as well, the following persons should not get the COVID-19 vaccine at this time: pregnant and breastfeeding women, people younger than 18 years of age, people with a history of severe reactions to a component in the vaccine. Now, on the day of the vaccination, these are things that persons should look for. Have a good meal or non-alcoholic beverage. Wear clothing that will provide easy access to the upper arm for vaccination. Short sleeve or sleeveless should work. Your immunization card, I know the Minister had his, or clinic card where applicable. Now, after the receipt of the first dose, the immunization card will be updated with relevant information, including the type of COVID-19 vaccine administered, the date received, and the next appointment date. Now, an immunization card will be provided for those who do not have their card or cannot provide it at the moment. So that should not be a deterrent for coming to get the vaccine. Persons will remain in observation for 30 minutes before leaving the facility. And members of the public will be contacted to be reminded of their next appointment date. Persons should return to the same facility for their second dose of the vaccine. And a reminder that in Trinidad and Tobago, the vaccination is voluntary. Minister?
Sorry about that, but I had to take that call. Yes, go ahead.
Good afternoon, Minister.
Good afternoon.
So we have some fresh reports coming in from UK's regulators. The MHRA announced a clear link between the AstraZeneca vaccine and the blood clots today, reporting a total of 13 blood clot cases last Friday alone. Given that the 33,600 doses of the first tranche in Trinidad are of the AstraZeneca origin, will the rollout continue as scheduled, or will an alternative vaccine be considered?
All right. So the rollout will continue as planned. What has also been said, and which I think we should also report on, is that the benefits of the vaccine in terms of preventing deaths far outweigh whatever minimal risks there are. Okay?
Thank you.
Welcome.
Gentlemen, usually following up on that same question, are you at all personally concerned based on those reports?
If I was, I wouldn't be here. I have absolutely no fear in taking the vaccines, and I will lead by example.
Going back to the Prime Minister, I know you said that the contact tracing is ongoing and payments and all that stuff. But is the contact tracing being restricted to Tobago? Or it has
No. As per protocol, whether you are deemed positive in Tobago, in Trinidad, the protocol is you contact trace everyone you have been in contact with. So that would include both Trinidad and Tobago.
because people are trying to narrow down where exactly the Prime
Well, that is what the contact tracing will reveal. Right? Any other questions?
There are reports that our CMO has tested positive.
That is absolutely false. I just spoke with the CMO half an hour ago.
Also, was that doctor on the phone?
That was a personal call.
Are you concerned that you will contact with the Prime Minister?
No, the last time I was with the Prime Minister physically in the same room was the Saturday he hosted a press conference, not last Saturday, the Saturday before, which is about a week and a half ago.
And your other colleagues, are you concerned any of them might have been in contact?
The contact tracing will reveal all of that.
All right, thank you very much.
No. Any other questions? Because once I take the vaccination, yeah, Joel.
Just one question.
Sure.
Minister, in terms of the arrangement concerning the COVAX facility and the vaccines, AstraZeneca, the thought of it, anyone has a particular history of being sick or close, taking the vaccine, who is liable? Is it private government? Who is that?
And that is why, if you recall, a few Saturdays ago, I spoke about the indemnification agreement we have. And that is why we ask all persons who are trying to bring in vaccines. This is an issue, and no one can tell us that they have an indemnification agreement. The private sector parties who wish to bring in the vaccines, I keep asking that. Right? So we have a cabinet-approved indemnification agreement.
And that agreement, just to be clear, for those who don't understand, it specifies what's
It specifies what the manufacturer is responsible for.
and what the government is responsible for.
Correct.
Would you be able to give a little explanation of that?
It's a legal document vetted by the Attorney General. I wouldn't like to give a layman's interpretation of that. But that is why we have an indemnification agreement. And that is why we ask everybody who wishes to bring in vaccines, show us your indemnification agreement. And so far, no one can.
Any updates in terms of the private sector collaboration with the government?
As I said, we are working together, and the day we have something that is concretized, we will come to the public. So far, we have none, because many of the questions we ask cannot be answered, especially on that indemnification arrangement. Okay? Any other questions? No? Great.
You take your first dose today. When do you expect to take your second dose? And in terms of, the expiry of this?
Okay, so prior, as you know, the Chief Medical Officer has discussed this, because you asked the questions several times at the press conference, and he has indicated that after we reach halfway, we will make a decision on how far we go with the program. He has said so publicly.
So you're not concerned that you should expire in time to the second dose?
We have more doses coming in prior, as we have explained, from COVAX in May.
And if it doesn't come in time?
It will come in time. Have no fear prior, but I do appreciate your concern. One more question, please. TTT? Sure.
There was a line of persons, I'm not sure if you saw it, a line of mostly elderly persons showing up at the Diego Martin
Yes.
Health Center to register to get vaccine. Can you clarify is there any procedure?
Yes.
to have those registered?
So what Dr. Tom did at Diego Martin was send out his customer service reps took down their names and phone numbers and pre-registered all of them. And then they would be called to be told when to come in. Right? That was of the 21 sites, that was the only site that had it to that extent. And again, it speaks to a high level of vaccine acceptance, which is good.
But is there any plan per se to try not to get this competition as if everybody should not have one steroid?
Yeah. So as I said, it seems to have been limited at this point in time to mainly Diego Martin. So we pre-registered all of them. All right? Okay? Right.
All right, so it's fine. Okay, good.
So we are seeing the Health Minister, Terence Singh, getting ready to prepare for his jab of AstraZeneca, the vaccine, the COVID-19 vaccine, as a source through the COVAX facility. Now, the devil is in the details, so allow me to correct myself. We actually received 33,600 doses versus what was previously said. We also had the communications officer from the Health Ministry, Alexander, speak to some of the logistics. If you are going to be collecting or getting your vaccine, have a good meal before. That meal should not include alcohol. Your clothing should provide upper arm access, as we're seeing with the Health Minister at this point in time. Please do like the Health Minister if you can and walk with your immunization card. And you will be observed for 30 minutes before departing after receiving your vaccination. And you will also be called and reminded of the next time you're supposed to be coming in for the second round of that shot. And once again, this is something that is totally voluntary, but individuals have been speaking to a high rate of vaccine acceptance. So we are actually looking to see now what is happening with regard to the nurses getting the health minister's dosage prepared so he can get that jab as it is described.
They want it in slow motion, so give it pay.
The individual administering the vaccine to Minister Bielsick is Ms. Helena Peters, District Health Officer.
Yeah.
Excellent.
And that's it. That's all she wrote. Okay, any questions? Good. Give me time. Very good. Get stronger. Get faster. I don't know what's faster. One more.
Okay, ladies and gentlemen, in keeping with the protocol, the minister will be asked to sit in observation room for the next 30 minutes. We have come to the end of the short conference. Thank you, ladies and gentlemen, for your time. Please do have a safe journey. And remember, wear a mask, wash your hands, and of course, get your vaccine.
And we're seeing some congruence of art meeting science as we had the health minister posing after receiving the first half of his shot, AstraZeneca, the vaccine. He gave a little breakdown. As at 2 p.m., there were 727 doses administered around the various RHAs. He gave a breakdown of that. And we are actually taking it to the sister aisle where we have the Secretary of Health, Wellness and Family Development, Tracy Davidson Celestine, getting ready to receive her shot. So we actually go to Tobago for that now.
Good afternoon, ladies and gentlemen. Good afternoon to all our viewers on TTT, on the Division of Health, Wellness and Family Development's Facebook page. It is indeed a great day. It's Vaccination Day, COVID Vaccination Day in Trinidad and Tobago. I know the minister just had his jab, and we in Tobago are excited where our Secretary of Health, Wellness and Family Development, Assemblyman Tracy Davidson Celestine, will receive her jab. At this time, I will invite her to give her remarks, after which we will witness her getting her vaccine. Secretary.
Thank you very much, Mr. George, Senior Communications Officer in the Division of Health, Wellness and Family Development. Let me recognize our leaders who are here in this particular exercise. First and foremost, Secretary in the Division of Infrastructure, Quarries and the Environment, who is also present to take his vaccine, as well as Ms. Ingrid Melville, Chairlady of the Tobago Regional Health Authority. She is here to give support. CEO of the TRHA, we have the Acting Primary Care Manager, Dr. Roxanne Mitchell, and I wish to take this opportunity to recognize all of the staff at the Scarborough Health Center and the rest of the staff throughout the Tobago Regional Health Authority, and of course you, the members of the media, who have been helping us to spread the message as it relates to what has been happening with regards to COVID. And I'm hoping that you will be partners in this exercise as we continue to educate persons about coming out and being part of the vaccination process. I just want to use this opportunity at this point in time to indicate that our systems are go, basically, in Tobago, and I suspect in Trinidad and Tobago as well. To date, we have approximately 1,500 and about 50 persons registered to take our vaccines. Of course, you know that we have started a pre-registration exercise, all in an effort to get persons interested in taking the vaccines, and more so to ensure that we start the process in terms of how we educate and in terms of how we will build out our systems going forward. And I really want to congratulate all those who have signed up to date, those 1,500 and approximately 50 persons, for coming forward and being a part of this exercise. As I've indicated to all and sundry in Tobago and in Trinidad and Tobago, it is important that we sign on to this vaccine. It is important that we be a part of this process, because for some time now, I think it has been over 12 months, we have been feeling the pressures as it relates to COVID. Our schools have not been reopened for some time now, and even while we attempt to have standard 4s and 5s returning to school, and even those who are to sit the advanced level certificate exams, we saw how that rolling out. We know that parents are under pressure because basically child care facilities are closed, and parents are now reeling from the effect of not knowing how to care for their children while they are at work. We also have the challenges with persons who were once employed in the tourism sector, because we are not able to attract international guests, whether it be by plane or cruise ships. Most of those persons in that sector have been affected. Luckily, here in Tobago, we have the domestic market, and we are seeing persons from Trinidad coming to Tobago to be a part of our accommodation and to cause employment to be created for those who are taxi drivers and otherwise. But throughout the world, people are suffering as a result of COVID. I know that some persons are very, very scared. Some are very concerned, because I've heard it. People believe that there are some people believe rather in some conspiracy theories out there. Some are saying that it's the signs of the end of time. Some are saying that the vaccine is a chip that some persons who have money would put into their systems in order to collect information. And there is all sorts of negativity out there as it relates to the vaccine. But I continue to tell people that more persons have died from COVID than those who have so far taken the vaccines. When I look the world over, I see good news. I see good news coming out from the United States of America. This morning, when I logged on to see what was happening, in Florida alone, I think it was in Miami, by 10 o'clock this morning, over 2,000 persons would have come forth to receive the vaccines. Now over 100 million persons are vaccinated in the United States of America, and more than that, on a daily basis, approximately 4 million persons are vaccinated. And you have seen how that vaccination have spurred the reopening of the United States of America economy. Here in Tobago, we want it to be the same. There is no reason for us, any of us, to be scared. As a matter of fact, there have been over 113 medical practitioners who have since taken the vaccines, and they have gone about their work as normal. We have not had any adverse reports coming out from those persons who have since been vaccinated. So the point I'm making here, in essence, ladies and gentlemen, it is important that if it is that we want to reopen the economy, it is important for those of us who love Carnival and would want to see Carnival come back in Tobago and in Trinidad and Tobago, that we come forth to take the vaccines. It is important for those of us who even like harvest festivals and those very large weddings. If we have to go back to that time, it is important that you, as the residents and the citizens out there, come forth and take the vaccines whenever they are available to you, the members of the public, in large measure. And so this is my appeal, this is my message to all of you who are listening. Come out, be a part of the process, and I'm really hoping that the members of the media would assist the Division of Health, Wellness and Family Development, and also the Ministry of Health, as we continue to provide that education to the people out there. So those are my few words, and of course I'm now ready to have to take my vaccine.
All right. Thank you very much to our secretary. We open the floor to questions from members of the media. at this time. So just use the mic, please.
Liz Williams, TV6 News. Just wanted to know from you your words to the Prime Minister in light of him testing positive for COVID.
In terms of my words to the Prime Minister, I of course wish him a very speedy recovery. The Prime Minister is based here in Tobago at this time, and I know that he has been receiving excellent medical care from our staff here on the island.
Did you at all meet with the Prime Minister while he was in Tobago?
No, Liz, I have not met with the Prime Minister. It was the Easter holidays, and of course, you know, we decided to break from the tradition of working even on the weekend.
The COVID-19 pandemic, it's no respect of persons. What words of caution do you want to tell persons out there? Because even the Prime Minister contracted COVID-19. Some persons believe that they are invincible. What do you want to tell persons, members of the public?
Well, I'm really hoping that the Prime Minister would be an ambassador for the division and also for the Ministry of Health and for the rest of the country. And at some point in time, he would indicate, his own feelings from a person who would have contracted COVID within the not so, distant future. I really want to use this opportunity to indicate that COVID really does not discriminate. And it is very important that we go out and be vaccinated in order to, of course, preserve our lives, which is what we are trying to achieve here from the Division of Health, Wellness and Family Development.
Good afternoon, Secretary. As you're going to take the job, how do you feel personally? Any jitters or anything like that? I mean, it could just be natural, but anything of that sort?
Well, I am in fact very nervous. Very nervous, but of course, I'm very accustomed to taking vaccines. I, for one, try to ensure that I take all of my vaccines. And so from childbirth right up to even adulthood, I have always ensured that I, subscribe to doing my vaccinations.
So the message out there, the message I want to send is, even though you might be nervous, even though you might be scared, this is something that is necessary to be done?
Yes, it is something that is necessary to be done. Of course, you would know even from childbirth, quite a lot of us have, taken our vaccines, whether it had to do with yellow fever, the tetanus injection, that kind of thing. All of those are aimed at preventing us from, contracting infections that can be, in fact, life-threatening. And so this COVID vaccine should also be looked at in that context. It is about preserving our lives, and, of course, it's about helping us to prevent, contraction from those viruses.
All right, just asking members of the media, identify yourself and your media house before you ask your question. Go ahead, Carissa.
Carissa Douglas, TTT Limited. I think Dr. Mitchell might be able to answer this. In terms of the targets each day at each site, what are you all looking at? Numbers? How many you hope to cover each day?
All right, good afternoon, everyone. All right, the vaccination plan for Tobago, we are hoping to achieve at least maximum 150 per day. The target is 50 per site per day, but in the event that persons do not show up at one site or we have extra persons showing up at another site, we will take them. But we can safely accommodate up to 150 persons per day.
Dr. Mitchell, today at this site, how many persons thus far have come to receive their vaccines?
All right, so we did about 60. We had 57 prior to the press conference. We do have some persons in the back, so we did 57 at this site. We were booked originally to have 50 this morning because of the press conference. We do have a couple persons in the back, and of course the secretary and her party will have their shots as well. So we're hoping to round out at about 60 by the end of today at this site. We have 42 persons booked for Roxborough. As of this morning, we had 27, so we're waiting until the 3 p.m. to be able to report on that. And we have 37 booked at Canaan. They are conducting their vaccinations at present.
Dr. Mitchell, Lois Vincent, CNC3. Can you say where exactly is, I'm not sure if you'll be able to say, or can anybody be able to tell us where is the Prime Minister being isolated at this point in time?
All right, I would leave that for the Minister, and both the Minister of Health and National Security to disclose that information. I'm not sure I'm at liberty to do that.
Okay. Maybe Mrs. Celestin will be able to assist us. Do you know if any other secretaries would need to go into quarantine at this point in time?
Well, I can't say that there are any other secretaries who were exposed to any primary or secondary contact at this point. If there are, you will be notified.
Any other? If no other questions, we will move straight into the administering of the vaccine to the secretary. So I invite all the respective nurses at this time. Sec, you may have your seat.
So we are seeing the Health, Wellness and Family Development Secretary Tracy Davidson Celestin getting ready to receive her jab. And she was quite honest about her feelings of being a little nervous, though this is something that she would do as a matter of course in the sense of being vaccinated. And using that very real sentiment to share with fellow Tobagonians and members of Trinidad and Tobago that even though you may have some misgivings just in terms of nerves, jitters, follow the science and all should be well. She also spoke about the fact that she tried to debunk some myths about the vaccine and spoke about the importance of having festivals, opening borders, balancing lives and livelihoods, and saying that the vaccination is an important tool in the overall toolkit of getting that done.
Use this opportunity to encourage our sec. It's nothing to be afraid of. It's a responsible thing to do, even as the nerves is quite visible. But we are really happy that we are at this point where we are vaccinating members of our population, starting with our secretary. Well, we did start before with the few shots that we got before with the frontline workers, but we are continuing with our secretary and other members of the public. Yes, you want to get a clear shot, so we ask this. Perfect. So for all those who were wondering, the Secretary of Health, Wellness and Family Development has indeed taken her COVID-19 shot. Excellent. So once again, we give kudos to our secretary, and she will be going into observation for a half hour. So this is where we will bring the curtains down on this very brief ceremony where we would have administered the vaccine to our Secretary of Health, Wellness and Family Development, Assemblyman Tracy Davidson Celestin. It has indeed been a pleasure. I wish everyone a wonderful day, and I encourage persons, get vaccinated. This is where we get back to some sense of normalcy. So this is where we start. So I encourage everyone, if you have doubts, we have the medical experts. A lot of things will be rolled out from the division in the upcoming days, in the upcoming weeks, where you would have the opportunity to interact, to engage with our experts, to answer whatever questions you have. So I encourage persons, get vaccinated and help us to fight COVID. Thank you very much. Have a wonderful afternoon.
And there you have it, Assemblywoman Tracy Davidson Celestin, as well as the Health Minister, Terence Dayal Singh, showing different levels of comfort but no less commitment in getting their first round of the AstraZeneca vaccine. Reminding you, there were 33,600 doses that came into Trinidad and Tobago through the COVAX facility. And as these stories continue, we will bring them to you on all of our arms. That was the update at this point in time. Thank you for tuning in. I'm DK Rasta.
The winning numbers in the National Lottery online draws for Tuesday, 6th April 2021. At 10:30 a.m., play away the number 8 Tiger, Mega Ball called. Pick two numbers 11 and 35 in that order. Pick four, numbers 6, 9, 7 and